Right now, we are amidst the global pandemic that is COVID-19. Everywhere you go, you see the effects it has had on society. And every time you turn on the news, you see the numbers of cases, deaths, and sometimes even just the number of people tested. But what do these numbers mean, considering that people are dying all the time from any and everything? So here is the COVID-19 compared to the flu. So first thing is just what makes a pandemic. A pandemic, as defined by the World Health Organization, or the WHO, is an epidemic which is just a widespread infectious disease occurring worldwide, crossing international boundaries, and usually affecting a large number of people. So by this definition, COVID-19 is definitely a pandemic, considering it has affected every country in the world. So it is widespread, crossing multiple boundaries. But by this definition, the common flu could also be considered a pandemic, as it infects millions of people as well as crosses international boundaries, but normally isn't, due to the fact that it is less severe than COVID-19, as well as there are known vaccines and treatments to it, making it less severe. So next is, what's the difference between a flu and a coronavirus? A coronavirus is a common virus that infects the respiratory system that everyone normally gets one in their life, normally when they're a young kid. This is why cleaning supplies such as Clorox say they can kill coronaviruses. And then a flu is also a respiratory infection, but the main difference is that a flu spreads faster, and many flus have vaccines, while the normal seasonal flu seems to spread through children and their unsanitary ways, and while the coronavirus seems to be spreading through adults and mostly only affecting adults. So now the COVID numbers right now, there are 4,099,310 cases. These are both confirmed and speculated cases. Not all of them have been tested, as well as 145,000 deaths, both speculated and confirmed, as some of them weren't tested, they were just suspected to have had it. So here's our new cases per day, which you can see is still increasing despite all the regulations that have been put in and us quarantining for a while. And then here's total cases. As you can see, just keeps getting steeper as we get more cases every day. So then the flu numbers, the flu season of 2017 to 2018, which is a normal flu season, infected 45 million. It said 21 million people go for medical visits, 810,000 people were hospitalized, and then 61,000 people died due to flu. And so these are people who visited the hospital due to flu-like symptoms, which on average was about 2% of all hospital visits were from flu in a given week, but it peaks around 7.5% of people visiting the hospital are from flu-related illnesses. So now, to compare the numbers, you could just look at it and say, well, the flu infects 45 million people while coronavirus only infects 4 million, so then you think the flu is worse. Or you can just look at deaths and say that COVID has more deaths than the flu, meaning that COVID is worse. But you want to look at both, as you want to see how many people who get it die, so that would be the fatality rate. So right now, COVID has a fatality rate of about 2%, but many experts are expecting a 0.5 to 1% fatality rate, while the common flu, seasonal flu, has a fatality rate of 0.1%, which even though that the COVID fatality rate is so low, it is still 5 to 10 times as lethal as the common flu, so it is definitely an illness we need to worry about. So in conclusion, it compares to the flu, as they are both very fatal diseases and very common diseases. But the coronavirus is worse because it seems to affect a lot of older people, as you can see in the percentages here, how these are percent of people dying due to the flu and coronavirus. in the US. So in younger age groups, the coronavirus has almost no effect, while in the older categories, it was killing up to 10% of the people who would get it, which this is as of March, so I believe the numbers have gone down. But since the coronavirus is still going on, all the numbers are subject to change, so in the end, it could be a lot worse or a lot better than we suspect right now.